My name is Dr. John Perdrizet. I live in Western Massachusetts in the town of Holyoke, and my clinic is a sanctuary animal clinic. I will do both large and small animal. I usually split up the day doing small animal one part and the other part large, and it varies depending on which day of the week it is, whether I'm doing large in the morning or small. When I'm doing the small animal, I usually have one technician in the room with me doing it. The rest of the day, on the road, sometimes the technician comes with me. Most of the time I'm on my own. I leave in the afternoon on a Monday afternoon, say around 1, and depending on the time of the year, I come home somewhere between 5:30 and 9:30 at night. And those days when I'm on large animal, I take care of just about every species there is out in Western Massachusetts. That's cows, horses, sheep, goats, llamas, alpacas, an occasional pig. And when I'm on the farms, it's everything from wellness to emergency work. A typical day could include a horse farm where I'll do vaccinations, take a look at sick horses, an animal that on that particular farm may have had a case of laminitis or uveitis in the past, and they'll want me to recheck that animal to see how well it's doing. At the same time that we're taking a look at the other animals and making sure that they are healthy and vaccinating them. Occasionally taking blood samples to test for various diseases. Lyme's disease is a big problem in our area. Ehrlichiosis is a problem, and we'll take blood samples and test for these diseases. We'll also do routine dental care on a lot of the species, and particularly horses. They usually need it at least once a year, often twice a year, depending on the mouth of the particular horse. We do everything from miniature horses right on up to draft horses when we're doing that. Why I became a veterinarian to begin with, I believe the number one, obviously, is, in most veterinarians you'll find, is that the love for animals. We absolutely love animals. I have pets. I've always had pets. And wildlife. I'll spend a lot of time in nature trying to track down deer and coyotes and everything else just to get a glimpse of them and see them. So I particularly, in my own case, I love animals, and that is probably the number one motivator for why I do what I do. I also have come to appreciate, as I've gotten older, that human-animal bond and how important it is for humans to have animals in their lives and how enriching that can be. There's certainly, we all know, we've heard of the studies where just being around a cat and petting it can decrease your blood pressure, increase your endorphins, and make your life much happier. And I've found, particularly for myself, that being around animals has made me the happy person I want to be. Every veterinarian has a different temperament. Some of us love to be in the hospital doing surgery all day. Some of us love to monitor anesthesia. I particularly found for myself that to be in one room all day looking at animals, even though I love animals and I love my clients, can be a bit much. I need to be outside. I need to be in contact with nature, and one of the nice parts about large animal, part of my practice, is you are out there in the nature, out there in the elements. If it's raining on you. If it's sunshine, it can be a beautiful day. And there's nothing that beats a beautiful fall day in Western Massachusetts out in a field. I mean, you can't do any better than that.